right, you guys, you might have heard the term incontinence, and usually that means actually leaking urine. But when we're talking about any of these issues with your pelvic floor, we're also including urgency, frequency, which means that you go way too many times a day, or we have clients who arrive and use the restroom. We finish a 1-hour session and they want to use the restroom before they leave. That's not normal bladder function, and it can set up some problems. So when we're talking about incontinence, just know that it also includes not just leaking, but also any kind of pressure, urgency, history of UTIs, and also that frequency. You guys know myth busting is my favorite. Myth number 2, that incontinence or leaking pee means that you have a weak pelvic floor and should just do your Kegels. Okay, I'm not going to go on a Kegel rant, I promise. However, a lot of times there's a lot of other issues. If you listen to our other videos, which you should, we talked about how surges of different hormones can create laxity and can create different changes in pressure and tension inside your pelvic floor and with the uterus and the bladder. Maybe you've had a hysterectomy and you're like, why is that even a thing? I don't even have a uterus. Sometimes that change in stacking and the scar tissue can cause pressure and changes with the bladder. There's a lot of things that can be going on that have nothing to do with weakness. And a lot of times if you just try to do Kegels, you're going to get frustrated because you don't know if you're doing them correctly. You might actually create more symptoms or worsening of symptoms, and we don't want that for you. So please know that a lot of times leaking does not mean you have a weak pelvic floor. All right, you guys, stay tuned for myth video number 3, where we go into some of the solutions that are available to you that don't need to include wearing a pad or panty liner, medications, or surgery.